What we see during COVID, this red line is almost flat. So that's really worrying. That's suggesting that older children are showing much higher emotional and behavioural scores than would be expected. Indeed, a 10-point difference by age 8 between before the pandemic and during the pandemic. It kind of suggests that these older children are stuck at the emotional development level of the terrible twos. My name is Dr. Rebecca Pearson. I'm a senior lecturer in psychiatric epidemiology at the University of Bristol, and we've been investigating the impact of the pandemic on children's mental health. This research is really important because there's evidence that mental health is worsening in adults and teenagers in lockdowns, but very little is known about the impact on younger ages. We do know that parents are stressed and that educational attainment is being affected, so we now need to look at mental health in young children.
What do you think about the schools being closed again?
Upset and a bit worried.
Why are you worried?
Well, I'm worrying if people in my school might get sick or ill. Because I think my friends have coronavirus and they don't get to go anywhere because they got coronavirus, so they need a vaccine.
So what we were able to do then, using the fantastic Children of the 90s data, which has tracked its latest generation since they were born on over 700 young children's emotional and behavioural development, we built on this data set, sending out new surveys during the first stages of the pandemic in around May and June, asking the same questions that have been asked of these same children since they were born about their emotional and behavioural development, items such as are they easily settled, how often do they have tantrums. So then what we can do is we were using these data sets to build trajectories according to age of emotional and behavioural development before COVID and now during COVID and compare the two. The results are shown in this graph, and what we have here is according to age from 0 to about 8, we have the emotional behavioural scores shown up high on the x-axis. So in blue we've got data pre-pandemic, and then in red we have during the early stage of the pandemic. So firstly what you see is this peak in both lines at around the age of 2. Higher emotional behavioural scores, the so-called terrible twos we all know, filled with tantrums. And actually what you can see is the red line's a little bit below the blue line here, which suggests that during the pandemic, younger children between 0 and 3 may actually have been a little bit less emotional. But now what's striking is that the blue line goes steeply down. That's what we expect. Into later childhood, 5, 6, 7, primary school, emotional and behavioural problems, they go down. Children are more settled. But what we see during COVID, this red line is almost flat. So that's really worrying. That's suggesting that older children are showing much higher emotional and behavioural scores than would be expected. Indeed, a 10-point difference by age 8 between before the pandemic and during the pandemic. It kind of suggests that these older children are stuck at the emotional development level of the terrible twos. So what this means for policy is there's a projected risk in this generation for mental health problems later. So there needs to be prevention in place, there needs to be resources for mental health, and this information needs to be put alongside the information about the physical side of things. Physical health and mental health need to be balanced together to make decisions on future policy regarding school closures and access to resources.